And you know, chances are you've been seeing a lot of pink this month. October is the time dedicated to talk about breast cancer, to raise awareness, and pink is the color to show that. Fox News cares about your health, so we have Cassie Gorganis here. She is a genetic counselor with USA Health Mitchell Cancer Institute. Cassie, thank you for stopping by.
Thank you so much for having me. I really appreciate it.
You know, we talk a lot about knowing your genes. I guess my first question is, when should someone seek a genetic counselor like yourself?
That is a great question. So particularly for breast cancer, we recommend somebody consider genetic counseling and genetic testing when they've been diagnosed at a young age, young meaning typically under age 50, age 45. If they have a history of multiple breast cancers in their family, so if mom, aunt, grandmother has had breast cancer, considering that, and if a person's had multiple cancers, maybe a breast cancer and a colon cancer, a breast cancer, ovarian cancer. Those are all different situations where somebody might want to consider having genetic counseling and genetic testing.
Yeah, you know, Shelby and I were talking during the commercial break about that genetic testing. What's involved in that?
Yeah, so genetic testing is a blood draw, but essentially the patient comes in and they sit down with me and we go over about the genetics of breast cancer, about how mutations in these genes such as BRCA1, BRCA2, CHEK2, ATM, and others cause breast cancer and can cause other cancers. And then after we talk about everything, I get a patient's personal and family history, and then if they decide to do the testing, like I said, it's a quick blood draw, get the results back in about 3 to 4 weeks, and I go over those with the patients, what it means for them and their families as well.
And without getting too specific, I would imagine the cost varies on each individual.
It does, but usually as long as a person meets what we call the National Comprehensive Cancer Network's guidelines for this genetic testing, then their insurance will likely cover it.
Okay, and you mentioned a lot of genes there, and I know that there's like a tumor suppressor gene. Talk to us about that and why we need to know the difference.
Right, so all of these different genes that I mentioned are tumor suppressor genes. Tumor suppressor genes are good genes that actually everybody in the world have. It's if you have a mutation in that gene that tells us whether or not it's working, and which gene then tells us which cancers you have an increased risk for. So some of those genes only cause an increased risk for breast cancer, but others cause an increased risk for breast, ovarian, prostate, you know, multiple different cancers.
Lastly, you know, final thought with it being Breast Cancer Awareness Month. What would you like to tell people watching?
Yes, I would just say, you know your family history. Talk to your mom, your sisters, your aunts, your grandparents. Know the family history, know who was diagnosed, how old they were, and if you're seeing some of those signs of a genetic breast cancer that I mentioned before, young age, multiple family members, then talk with your doctor because genetic counseling and genetic testing might be right for you.
Thank you.
Thank you
so much. Cassie Gorganis joining us there from the Mitchell Cancer Institute. And you can watch this interview again, share it with someone you know, valuable information there. So we'll have it posted shortly on our YouTube channel. And if you click the bell, that little icon, you'll never miss out when we post a new video there.